Hello and welcome to another episode of the Melbourne Athletic Development Podcast. Today we're very fortunate to have with us Professor Kevin Miller from Texas State University. Kevin, thank you very much for being here today.
Oh, my pleasure. Happy to be with you. Thanks for the invitation.
So to give some context to the conversation, can you introduce who you are and your professional background?
Sure. So my name is Dr. Kevin Miller. I'm a full professor here at Texas State University in our athletic training department. I have studied and done research on all kinds of exertional heat illnesses in my career, primarily focusing on exertional heat stroke as well as exercise associated muscle cramping. And thus far in my career, I'm one of the few people who have proposed new theories for why muscle cramping occurs during exercise, as well as done some studies and helped guide our decision-making process and helped written several position statements, consensus statements, and roundtables about how best to prevent, treat, and diagnose exertional heat illness.
What made you start to look into heat illness and obviously the associated cramping research? What sort of took you down that path?
Sure. So I have a very bad personal history of muscle cramping during exercise.
It's
I was
always the
a
case, isn't
soccer
it?
player, right? I was a soccer player when I was an adolescent, and I would just get very bad hamstring, quadricep, calf cramping, especially when we would have, two-a-day games or tournaments on the weekends where the conditions were typically hot. And so exercising in those conditions, my muscles would just cramp up. And uh, as a result of that background, going into university and learning more about exercise physiology and how the muscles work and how our nervous system works, it always fascinated me that we were so sure at the time back in like the late 1990s, early 2000s on what caused cramping. And everybody said it was salt loss and dehydration, and you just got to, take in more sodium or you got to eat more bananas because it's potassium that you got to focus on. And it just always surprised me on how sure we were as to what caused these muscle cramps. Yet when I drank Gatorade or other sports drinks, or I consumed bananas like crazy, I would still get muscle cramping. And it was during an exercise physiology class in my undergraduate where an exercise physiology professor said, I don't understand why uh, sports medicine people believe that cramping is due to dehydration or electrolyte loss because when we sweat, our blood becomes saltier, not less salty, because we're
Yeah.
losing more water than we do salt in our sweat. And that really struck me. And I was like, holy cow, you're right. And so the kind of myths and the misconceptions that we had about cramping struck a personal chord with me. And then that kind of just set my natural curiosity ablaze and just decided that I was going to dedicate my life's work to better understanding muscle cramping and some of the other exertional heat illnesses, like I said, about like heat stroke.
So I'm certainly guilty as charged of having that perception that the dehydration and electrolyte imbalance theory is the cause of cramping until I came across some of your research. Can you explain the history of why there's such a strongly held belief around the dehydration and electrolyte imbalance theory that most people still believe today?
Right. I think this was a theory really born in the late 1800s, early 19th century, where you would have observations, typically very small sample sizes. These were people typically working in very hot, humid conditions like mines or like sugarcane fields, those kinds of very hot tropical climates. And people would observe that these people that were doing work in these very hot, humid conditions would often develop uh, exertional muscle cramping. And so when they were doing their observations, they would note these people would typically sweat quite a bit, and then they would replace their sweat losses with beer or other kind of hypotonic beverages. And as time progressed and the observations moved to like the Hoover Dam in the United States, some observations occurred where they noticed that the gentlemen that were drinking salted milk or salted water or other types of high sodium drinks tended to have fewer muscle cramps during their occupational work. And so that kind of led to this idea fast forward again 50 years to more athletic situations and like American football players, where again they're noting people that self-report a very severe history of cramping such that they required IV fluid replacement or medical intervention, that these athletes, again, typically very small sample sizes, we're talking about 5 to 10 athletes, when compared to non-crampers, and these would be people who did not require medical intervention, typically had higher sweat rates or had more sodium in their sweat than the athletes that were controlled for without that history of cramping. Yeah, it's very interesting when you look at those preliminary studies. Again, there's a couple of problems. Number one, the small sample sizes is a major red flag, because as you look at sweat characteristics in athletes, we have very wide ranges of data. I've had athletes who have sweat very little, and I've, of course, worked with athletes who sweat a great deal. But you can't just look at a person and say, well, you're going to be a quote unquote heavy sweater or a quote unquote super sweater. These terms have no definition in the literature and nobody knows what they mean. And yet they're thrown around quite a bit as like, oh, yeah, I know what that means. Like if I shake out my t-shirt and sodium flies everywhere, or if I see that salt ring on my t-shirt after I'm working out, I must be a super sweater or a salty sweater. But that definition does not exist in the literature. And so we think we have an idea of what we're talking about a lot of times, but it's very poorly defined. And so sweat varies considerably. One of the heaviest sweaters with the highest sweat rate that I've recorded in my career was actually a small female soccer player. And so she actually had a higher sweat rate than most of the linebackers or offensive and defensive linemen in American football. And so you can't just look at a person and say, you're going to be predisposed to cramping because you're a large person, or you're less predisposed to cramping because you're a small person, or you're female, or those types of observations. And so as time progressed and we kind of did more research and did better controlled research, and stopped using kind of the field observation athlete model, what we notice is that when you control for a lot of things, typically not control for in the field, things like how hard you're exercising, or the environmental conditions, or your diet, or how long you're exercising, when you control for all of those things and you look at people with and without a history of muscle cramping, what you find is the sweat characteristics are often very similar. And so my group did the largest prospective cohort study in Division I collegiate athletes. So in the United States, this would be like the best college athletes. And we looked at as many sports as the coaches would allow us to come test. So we looked at wrestling, field hockey, track and field, basketball, women's and men's. We looked at as many sports as we possibly could, 11 in total. And we just looked at whether or not those athletes had a history of cramping or they did not have a history of cramping. And unlike prior studies that were funded by the sports strength industry, we did not exclude people just by severe cramping. And so we know that the majority of cramping that occurs during exercise is not severe, right? It's not cramping that requires a doctor's intervention or requires another medical professional to come help you, or IV insertion or anything like that. Most of the time, exercise-associated cramps are generally mild or moderate, and athletes will stretch or reduce their intensity or stop altogether and do something like drink some water or eat something and then go back to their competition. They finish competition just fine. And so when you isolate the very severe, the worst of the worst crampers, and then compare them to the people who have never cramped, I think you're going to find those differences. But when you make your perception broader and you include mild, moderate, and severe crampers, like what we did in my study, you notice that there's no differences in sweat characteristics. That sweat rate, the sodium in sweat, potassium in sweat, chloride in sweat, the sweat volume, none of those things were significantly different between our two groups of people in 10 out of the 11 sports that we tested. The one sport where we did find that sweat characteristics were predictive of who was and who was not a cramp or a cramper was American football. And American football seems to be this very unique type of situation where the athletes are typically very large. In the Northern Hemisphere, They compete in those typical hot, humid conditions. They're wearing usually 10 to 15 pounds of extra equipment to protect themselves during sport. And so when you have all of those extra factors included, those people, they might benefit from some sodium replacement, some fluid replacement strategies. But for every other sport that we looked at, if you handed me a sweat sample, I could not tell you whether that person was a cramper or not, looking at just the sweat.
With that in mind, does that suggest that the electrolyte theory is debunked, or does it suggest that it's more nuanced and we need to understand, given particularly the example you use there of football, that there may be some association, but the theory in which it's currently presented is not the entire story?
Right. So this is where I think as scientists, we get guilty. We try to simplify things as much as possible, right? The Occam's razor effect, right? It's usually the simplest explanation that tends to be the most correct one. And I think in the case of muscle cramping, what we have here is a very complex injury that goes beyond this box causes this box to occur, and then two more boxes later, you get cramping. Instead, in the theory that I proposed in 2022, which we very cleverly called the multifactorial theory, we essentially said, there's more than one road to get to your destination. And so rather than thinking of cramping as having a singular cause like fatigue or dehydration or electrolyte imbalance, which, by the way, nobody ever knows or discusses what electrolyte imbalance actually means. We just throw that term out there like, oh, of course, electrolyte imbalance. But we never know what that term actually means, which electrolytes, how are they imbalanced? Is it a ratio? That stuff is never clearly defined either. But in the multifactorial theory, I tried to better explain all of these different observations that we see. And I think the reason why we see so many kind of conflicting observations in the literature is because sometimes certain treatments work for some people and they don't work for others. Well, if that's the case, I think what you're dealing with is a much more complex condition that doesn't have a singular etiology, right? If muscle cramping was due to just dehydration, then the cure is simple. It's hydration. And yet when you ask almost anybody that's had a muscle cramp during exercise, what did you do to treat and relieve that muscle cramp? The answer is almost never, well, I drank sports drink or I drank more water and then the cramp went away. It's almost always I did stretching. And so I always ask people, well, how much fluid is added to the body by stretching? How many electrolytes are added to the body by stretching? How much fatigue is alleviated by stretching? And the answer there is always, well, none. And yet, if I asked you, what is the cause of exertional heat stroke? Why do people die from exertional heat stroke? You would say, well, it's because their body temperature is too elevated for too long a period of time. And so the treatment for exertional heat stroke is cooling. And so it's not acupuncture, it's something that's completely different than the cause, right? So if the cause is overheating, then the treatment must be cooling. And so that's how medicine works. And yet when it comes to cramping, people were saying, well, the problem is it's loss of water. But then the treatment has to be restoration of water. And yet our main treatment that we use that almost works every single time very, very quickly is something completely unassociated with metabolism or fluid dynamics in the body or electrolyte dynamics in the body. And so Martin Swellnus out of Cape Town, South Africa was one of the first people to really highlight some of these, varied theories and why there was kind of a conflicting physiological argument. And then I came around after Dr. Swellnus and said, well, maybe if we rethink this, maybe because Dr. Swellnus kind of proposed that it's due to fatigue. And then I came along like, well, fatigue, I think, is a part of it. And I still think even dehydration could be a part of it because we know that when you're dehydrated, you will fatigue much more quickly. And so there's more that happens to the body during exercise than just a singular event like dehydration, right? Or electrolyte loss or fatigue. It's this very complex spider web of factors going on in the body. And so we proposed this multifactorial theory to try and get people to think differently about exercise-associated muscle cramping. And so the general idea is that, again, there are multiple roads to get to the same destination. And so if we think of cramping as having like this threshold, like this is where I cramp, well, maybe if I start exercise here, like lower than my threshold for cramping, but I don't get a good night's sleep. And so I'm more fatigued than normal. Well, I get a little bit closer to my threshold for cramping, but I don't cramp, right? We have plenty of very fit athletes that cramp and they're clearly well conditioned, right? So it can't just be solely fatigue. We also have people that exercise for a very brief amount of time and they get cramping. So they're not very fatigued at all. And so I think, okay, so we get that threshold a little bit closer. And then maybe your diet's not very good. Maybe you start exercise slightly hypohydrated and you get a little bit closer. And then you exercise at an intensity that's beyond what you had trained for. And now those 3 or 4 factors coincide together. And now you've met your threshold for cramping. But if you take away 1 or 2 of those things, now you don't cramp. And I think changing the philosophy to look at all the potential factors that might contribute to how our nervous system becomes excitable. I think by looking at those factors and by looking at a person's individual recipe, I think that better explains why we cramp under some conditions and not other conditions, why some people have a different recipe than I have. And so when we apply treatments, again, I think this better explains why some interventions work for some people and other interventions don't work for those same people. And so when people ask me the holy grail question as it pertains to muscle cramping, like how do I prevent cramping, right? They don't oftentimes like my response because the response is you've got to do your homework. And what I mean by that is you've got to figure out your own individual recipe for why you cramp, and then we target that recipe with our intervention. So rather than giving kind of shotgun advice of drink more X, right? Drink more sports drinks, add more salt to your diet, drink pickle juice or beet juice or cherry juice or these kind of very popular hot at the moment type products. We got to do our homework and treat this like a injury. And if you came to see me with an injury, I'm going to do a history. I'm going to observe you. I'm going to palpate your body, look for changes in your range of motion and your strength and your neurological activity. In other words, I'm going to do an evaluation of you to try and figure out why you're getting this medical condition. And when you approach muscle cramping like that, I think you remind yourself that this is not the normal for my body, that this is an injury. And when you do your homework, I think you'll be much more successful trying to prevent cramping if you understand the factors that preceded why you cramp. And again, acknowledge that there's more than one way to get to the same spot.
It makes me think of you speaking of the simplistic notion of cramping, how much the sports drink industry has to do with that as well, because it's obviously something that has been marketed as this is the solution to it. I was thinking one thing that would be good to start with then is actually talking about the pathophysiology of cramping. Like, what is a cramp itself?
Sure. So it's very important whenever you talk about a condition that you satisfactorily define the condition that you're talking about. And so muscle cramping, again, falls into one of those uh, injuries that has a lot of inappropriate terminology surrounding it. So things like contracture, tic, spasm, fasciculation, these are all very specific medically defined terms that are often used interchangeably with exercise associated muscle cramping. So very important for your listeners to understand that what we're talking about here is exercise associated muscle cramping, or what might be called exertional muscle cramping, or sometimes in the literature you might even see it as like occupational muscle cramping. The commonality with all of those is there's physical work involved, right? That's the major point to take away. And these are painful, involuntary, meaning that they're often not controlled on purpose, contractions of skeletal muscle that occur either during physical activity or exercise or shortly thereafter. And so these are very different than things like menstrual cramping, than pregnancy related cramping, than nighttime or nocturnal cramping, because all of those different other conditions have purported different causes. And so what we're talking about here are the cramps that occur during exercise or physical work. And so one of the things that I typically get on a soapbox with my students is the term heat cramps. And so I often ask them, like, has anybody heard of a heat cramp? And almost everybody raises their hand because, again, I live in Texas. It's very hot, very humid, and it's 110 degrees Fahrenheit in the summers, oftentimes for 3 months. And so I'll often tell them, like, no, you've never heard of heat cramps because this is a misnomer. And so heat cramps is thrown all around the literature and the scientific literature to boot. And it's a bad term that often is applied to exercise-associated muscle cramps, and yet we know that cramping is not related to your body temperature, right? It's not like we get muscle cramps first, then we get exertional heat exhaustion, and then we get exertional heat stroke. There's no tiered level of exertional heat illness. And so when we look at people that finish races and have muscle cramping and we look at their body temperature is oftentimes not elevated to dangerous levels. It's oftentimes not different between people who don't cramp. When we look at muscle temperature, it's not different. When we look at skin temperature, not different. And we know people get muscle cramping during exercise in temperature controlled places like swimming pools or tennis arenas, indoor facilities. And so for all of those reasons, we try to avoid using bad terminology. And again, when we say like something like heat cramps, I think it implies a treatment, right? If the cramp is due to the heat, well, then the solution is cooling. And yet, when you get a muscle cramp during exercise, I don't throw you an ice pack. I stretch your muscle until the cramp goes away, and then we try and figure out why did you get those muscle cramps to begin with. In other words, we try to find what your recipe is, and then we target that with our treatments and interventions moving forward.
With that in mind, you mentioned as well before that there were some like centrally driven factors that may influence it, and you might be able to allude to how they relate to fatigue or exertion. What happens both in our central systems, that is our brain and spinal cord structures, and what actually happens at the level of the muscle tissue itself when a cramp occurs?
Yeah, those are all great physiological questions. When we look at fatigue, for example, it seems like, especially in some of our animal models and animal studies, that when you fatigue the central nervous system, it seems like our neurological receptors become overexcited. So if you think of it like a teeter-totter, and on each side of the teeter-totter, you have excitation of the neurological system and inhibition or calming down of the nervous system. It seems like when our system becomes fatigued, we get an imbalance of that teeter-totter more towards the excitation. And so the neuroreceptors like in our muscles and in our tendons tend to behave differently than they would if they were not in a fatigued state. So receptors like our muscle spindles and our Golgi tendon organs, our muscle spindles tend to be excitatory to our nervous system, whereas our Golgi tendon organs tend to be inhibitory. They tend to try and tell our neurons that talk to our muscles to relax. Well, there seems to be an overexcitation towards, contraction in those situations. And so what exactly is happening within the muscle at a muscle cramp during exercise is actually unknown. And it's really tricky to do that type of research. I've tried to design studies to do that, and oftentimes would require like a muscle biopsy. And if you know anything about a cramping muscle, you understand how often painful that condition is and how hard and tense those muscles become when they're actually experiencing a cramp. And so right now our technology to better understand like what's happening within the muscle itself from a biochemical level is kind of tricky to do, because we would have to take a sample of that muscle tissue and then really analyze it to see what it was going through. And so a lot of the studies we have to look at that question are more EMG type studies or electromyography type studies to try and figure out what's happening to the neurological activity and how is the muscle reacting to the stimuli. And those types of studies show us that when a muscle is in cramp, we have a much higher frequency and higher amplitude spikes on the EMG than you would in a rested muscle or in an adjacent muscle that is not cramping. And so it seems like there's more excitation occurring to that muscle. And as a result, the cramp just kind of feeds upon itself. I think we get kind of stuck in this pain, cramp, pain cycle.
Positive cycle,
when we're able
essentially.
right, that positive feedback loop
Feedback, yeah.
where one thing begets the next thing and then causes the same thing, and around we go, and it becomes self-feeding. And when you break that cycle by physically separating the actin and myosin filaments by stretching, and you don't allow that muscle to contract and shorten anymore, you actually break that cramp. So that's what I think stretching is doing primarily. I know as researchers, there's some stuff in the literature proposing that there's kind of a fancier inhibition type mechanism that occurs with stretching. But for me, I think it's more of a physical, just separating the contractile proteins, because we know from other studies that if you don't allow a muscle to actually shorten, it doesn't cramp. And so that type of, again, physical work and concentric contractions are typically necessary to get a self-sustaining exercise-associated muscle cramp from occurring.
So that's actually interesting to note, because I know looking at treatment for exercise-associated muscle cramps, stretching is by far the most effective treatment intervention, but you think it's because more of a change in the peripheral tissue length as opposed to like a neurological input that alters the excitation of the nervous system.
Right, and there's some good data. I'm not saying it's completely just a physical separation issue. There is some data to suggest that, like, when our triceps serrae musculature, so like our gastrocs or our calves, are in a lengthened position, we get more Golgi tendon organ activity that occurs. So John Byrne and John is an Australian, and so he came out to the United States a few years ago, and we did a study looking at whether or not gentle static stretching changed any Golgi tendon organ activity after the stretch was released. And what we observed was nothing. So our receptors that were primarily using to think that, okay, when we stretch somebody, we're activating their GTOs. The GTOs tend to tell our central nervous system to relax. Well, that might be a possible reason for why cramps go away when we stretch them. And yet it doesn't seem to be a carryover effect. Like, as soon as that muscle was stopped stretched, we noticed no changes in Golgi tendon organ activity, the amount of firing, the area under the curve. And we looked at that at 1 minute post stretching, 15, 30 minutes post stretching, and it just didn't seem to be something that caused a preventative effect. Now, disclaimer for that study was we did not induce cramping. Instead, we took people who were not cramping, applied stretching, and then looked at their Golgi tendon organ activity. So again, there's a lot of work that we still have to do in this realm. But right now, I would say the two possible reasons for why stretching relieves a cramp is, number one, the physical separation of those contractile filaments, and then there is the potential for that inhibition effect through maybe Golgi tendon organ activity. Not saying it doesn't occur, but it's a little bit trickier to study, and so I tend to lean more toward the physical separation of those fibers than the more elaborate, again, kind of the Occam razor effect, right? Of simpler explanation is probably more accurate. So if you don't allow the muscle to grab and contract, then it can't cramp anymore. So I tend to lean more toward that explanation, but there is some good studies on Golgi tendon organ activity, again, in non-cramping individuals that might explain some of that. But again, I think probably a little bit of both is where the truth lies.
The other thing I think of with stretching is I know Gabriel Trajano has done some research with Tony Blazovic, and I think David Bem as well, of looking at the effects of prolonged stretching potentially inhibiting, say, force or power output. And one of the things that they've shown is it changes the activity of the persistent inward currents at the level of the spinal cord that influences the amount of calcium release that causes a high firing frequency. Does that has that been explored at all as being a potential mechanism associated with the positive effects of stretching on cramping as well? Because that would alter, I guess, the neural drive and the output from the spinal cord to the muscle.
I don't believe so, not in the context of cramping. I tend to agree with you that, like, when I teach our athletic training students about stretching, I tend to believe that stretching is inhibitory toward performance. And so I had a great, I think, again, it was Australian exercise physiologist in my master's program say, a cheetah doesn't stretch before it chases the gazelle, right? And so that kind of notion that we stretch athletes before competitive performance to help them prevent injury or improve their athletic performance, I think is not so much true. And so the only times I ever do static stretching of athletes is if they have a clinical lowering of their range of motion. And even then, I think we have to ask, is this the best way to help them regain their range of motion? Like there are joint mobilizations and some manipulatory techniques that we can use to bring back a joint's range of motion that go beyond just simple static or PNF stretching. And so I think the literature that you mentioned is oftentimes applied to the muscle cramp context to provide kind of a theoretical support, but actual experiments looking at that, I would say, are not yet done, to my knowledge.
To to make it really clear for our listeners, are you able to go through the factors that you think are the biggest contributors and then potentially outline, you've already outlined obviously something like stretching, but what sort of steps you would then take if you do think that those are the factors that are contributing to the development of an exertional cramp or exertional sort of cramping?
Yeah, that's a great question. So, for all the listeners at home, I think the easiest way to look at that too is to go back, find the paper that I published in 2022 that discusses the multifactorial theory.
Yep.
And the title of that paper is An Evidence-Based Review of the Pathophysiology, Treatment, and Prevention of Exercise-Associated Muscle Cramps. And it was published in the Journal of Athletic Training in 2022. It's on page 5 to 15. And in that paper, and maybe we can even link, if we can link maybe to the podcast, that article, I think it would be very helpful for the listeners, because within that article, I have a table on questions that you can ask your patients or yourself, and then keep what I call a cramp journal. So you can record all the possible answers and then look for patterns as you develop multiple cramp episodes during exercise. And then once you identify a pattern for you, that might be your first step in identifying your own particular recipe for why you cramp. Because again, your recipe might be completely different than mine. And so until we find our individual factors, we're going to struggle preventing them. And so in that article, I give you the whole spider web of all the potential factors that I think to date we've kind of identified. And I started putting together this theory when I was a PhD student, and it was like one thing just dominoed into another thing, right? Like pain can be a result of muscle damage, but it can also be something that's totally normal during exercise. But you also get increases in muscle temperature with exercise. And so it very quickly became this very complex spider web of factors. So the main ones, and I would be fully transparent and full disclosure, a lot of this we still have work to do to see how important is this factor towards cramp genesis. So a lot of times right now what we're doing is we're trying to take literature that we know from an individual factor, but then again apply it to a cramp context. And so things that I think typically are common for people, I would say, is the fatigue. Right? We know that muscle cramping during exercise tends to affect the working muscles, right? And again, that was kind of an argument for why it might not be dehydration or electrolyte imbalance, because if it were, I would get random cramps in my neck or in my back, but they're almost always in the targeted individualized muscles that we're working, like our hamstrings, our calves, and our quadriceps. And so I think fatigue plays a role. I think pain can definitely play a role as well. So if you have a prior history of injury to a muscle or you haven't fully recovered, I think, again, you get in that pain, muscle cramp pain cycle much easier. I think if you have a genetic predisposition toward cramping, there's some literature to suggest that that might be more so occurring on the father side of the genetic spectrum than the mother side. And so oftentimes the question that I'll ask my athletes is, have you ever had a cramp before? And so most of them will say, well, yeah, I get them all the time. And so when it comes to prior history or family history, I think that oftentimes is a major factor in why people cramp. So some people just seem to have a genetic predisposition towards this. I think you can also add on to that other factors that contribute to fatigue. So things like lack of sleep, maybe older age, maybe diet, and not having, satisfactory nutrition intake as far as a caloric intake, maybe not enough carbohydrates or things like that we typically use for our main energy source when we do exercise. So those types of things I think could contribute to cramping. Again, in the article, there's a whole table of questions that we ask. And as people can answer those questions after they get a cramp, it will help them identify whether that might be a factor for them or not.
Hmm. Speaking
But again,
of,
even in
no, go on.
sorry, but again, it's very important. Again, keep this in the context of it's probably multifactorial. So if you just had one factor, you probably might not cramp. It's probably going to be some kind of convergence of factors. So right now, like I've been talking for about 45 minutes, and yet you haven't heard me exclaim, "Ow, I'm cramping." And so we know that like talking for a prolonged period of time causes dehydration, right? Going in a hot tub, drinking alcohol, these are all things that cause dehydration. And yet, when you're sitting in a hot tub, people don't just jump up and grab their calves. And so, just one thing by itself is probably not going to do it. But when you get those other things combined, that's when I think you change the central nervous system activity. And so, any factor that could potentially change your excitability in your nervous system could potentially be something to include in your recipe. And so a particularly fascinating area that I think gets overlooked in the context of muscle cramping is psychology and how the mind influences the body. And so again, we're looking at not necessarily cramping per se here, but there are some research studies that have shown that stress and that just doing a simple task like counting backwards from 779 by 13 caused a change in the excitability of trigger points in muscles in people. And even stressful conditions or stressful injuries like tension headaches cause changes in the excitability of muscles. And so, again, not an area that I think we've explored enough in the realm of muscle cramping per se, but I think there's that foundation for the athlete that goes out and competes in a heightened psychological state. And again, that heightened psychological state might not cause their cramp, but it might push them a little bit closer to their threshold. And so the psychology of cramping, I think, is a very interesting area that doesn't get enough focus, that I think is one of those things that we got to look at in the future.
Yeah, so thinking about the etiology of cramping from a preventative standpoint, we really need to be thinking about some different systems or subsystems. So one of the big things that you've highlighted here is your overall nervous system excitability. So that can really start to relate to a lot of non-physical factors when you think about sleep, when you think about psycho-emotional stress, perceived stress. Do other things then that influence our nervous system activity have an impact on cramping, like say caffeine consumption or stimulants, which also may be particularly prevalent in athletic groups?
Sure. So again, I think, again, great idea. Excellent foundational research that we have on caffeine being a stimulant and excitatory. We don't have any studies that I'm aware of that have directly looked at caffeine consumption and cramp risk. So I was going to do a study like that way back in 2012, and then I changed jobs. And then didn't get a chance to do that study. But we were going to look at various amounts of caffeine and look to see, did that change cramp susceptibility, but simply haven't gotten that far yet. But exactly what I'm with you right there. Any kind of change that can be stimulatory or inhibitory could potentially influence the nervous system and therefore contribute to cramp risk.
And then thinking of other factors, you mentioned, say, nutrition with particularly caloric intake. Are there any physical parameters that influence someone's cramping? Because it's interesting to note, and you've highlighted this in your article, stretching is actually very effective at treating cramps, but it's actually not effective at preventing it. So does that indicate that things like range of movement and flexibility aren't really correlated to cramping? And are there any other potential physical factors associated with someone who's susceptible to cramping?
Yeah, so the data is kind of all over on the physical characteristics that might contribute to cramping. In some studies, they might say, well, men are more susceptible to cramping, but then when you look at the race data, like 80% of the population that took part of the race were men. So is it a true comparison of men versus women? We have some studies that suggest that higher BMI might be associated with cramping. And so again, the theory being that maybe the heavier people might not be as well conditioned, and so they may be more prone to fatigue, or because they're heavier, they might have to exert more energy to move their body through the same amount of space or perform the same amount of work. And
That
therefore,
would actually make
again, they
sense with
might
the
be more
American football players because obviously they are not necessarily overweight, but have a high amount of lean body mass too.
right. Yep. So those types of things, I think we need to flush out a little bit more. But from a flexibility range of motion standpoint, the work that I've done in my lab, where we've done more controlled studies and we've measured range of motion, we've tested, static stretching, we've done PNF stretching, which is supposed to target more of the neurological system. We've actually looked at the cramp threshold, so how easy it is for me to cramp someone. And I typically use electrical stimulation for that. And when we do stretching, there again doesn't seem to be any kind of preventative effect where it's just as easy for me to cramp a muscle after the stretching as before the stretching. And even when we look at like the field research, like there was an article published um, in rugby players that they found no differences in range of motion or flexibility. And again, Martin Schwellnus and his group has, via questionnaire, asked people what was their flexibility training and history and duration. And for the majority of all of those field studies, it does not seem that the amount of time that you spend stretching in the days or even weeks leading up to the event were different between the people who did experience cramping and the ones who actually did not.
Oh, sorry, you go, John.
No, no, go.
It sounds like, too, the way you're describing a lot of the literature, there's just so many gaps still in our knowledge and understanding of cramping and related factors. One other question I had for you, too, and I'm not sure if there's any research on this, but even if there's any anecdotal evidence, is cramping any way correlated to the development of, say, a musculoskeletal injury in athletes? Can it be a warning sign that leads to the onset of a soft tissue strain, as an example?
That I'm not aware of specifically as it pertains to strains. My group has done some work on what is the effect of cramping on future cramps. And so we did a series of experiments where we looked at voluntary induction of cramps. So we had people come in, they were rested, no exercise, no dehydration. We made sure they were very well hydrated and in a normal body state. And all we asked them to do was cramp themselves. And so people like myself with a very bad history of cramping, I think I could probably cramp almost any muscle in my body on command at this point. It's not a superpower. It's like the worst superpower you could possibly have, right? If you were a superhero. But these people were brought in, again, completely rested, no exercise, no sweat loss, no dehydration. They were simply asked, can you cramp your own calf? Or can you cramp like a muscle in your big toe? And a lot of people could do that. And then we looked at how easy it was for then me to induce a cramp with my electrical stimulation technique that I use. And following that initial cramp, it seemed like the risk for a second cramp was higher all the way up to 1 hour after the volitionally induced cramp. And so I think those observations, then we also did a study looking at the neurological activity. We did a study where we measured H reflex. And this is a technique where you get an idea for, again, the excitability of the nervous system. And what we noticed was the H reflex following the volitional cramp was also elevated for up to 1 hour after the cramp had occurred. And so I think that explains some of the observations that we see in the field working with athletes, where if you get a cramp in the third quarter of a football game or toward the end of the first half of a soccer match, you're much more likely to get another cramp in the second half of the soccer match or in the fourth quarter of the football game. And then as an athletic trainer or medical professional, once your athlete goes down with a muscle cramp, it's highly likely that you're going to deal with that athlete cramping again and again. And I think that's because that initial cramp kind of primes the system to make it easier for subsequent cramps to occur. So this has been termed in the literature as the muscle cramp state, where it's that period of time that occurs following exercise or following an initial cramp where your presupposition to another cramp tends to go up.
You just mentioned that. So obviously, as a clinician or someone who's going to be working pitch side, what do you do in that situation? You have your most important player, it's a big final, and they start cramping at the end of the first half of, say, a soccer match. What do you do? How do you attack that?
Yeah, great question. And so my typical response is any way you possibly can. And so it would be great if, again, we don't have to apply these, principles to every single person on the team. And so a lot of times coaches will, have me come speak and I'll tell them, like, if you just ask your team, how many of you have ever had a cramp before in your life during exercise or during an athletic event, right? You're going to get a lot of hands that go up, but not everybody's hand is going to go up. And so you don't have to apply interventions to people that don't need them. But just that very simple question of have you cramped before tells you who are your at-risk people. And so that's where you can take that subgroup and say, okay, now we're going to delve into your personal history and we're going to try and identify what your recipe is.
Do
And
you
so
have
if you
time to
do
do
have
that?
that,
Do you have time to do that if someone's on the side of the pitch and they're cramping? Like you don't.
Yeah, that acute
Yeah.
management.
What are you doing in that acute situation? Like obviously you may not have had the opportunity to have that discussion in the weeks, months leading up to kind of educate them. You're there doing coverage for whatever
right?
reason. It's the finals, and they're like, "All right, what do I do? What do I do?" And they're frantic. What's your approach at
Yep.
that stage?
Yeah, ideally it would be part of that pre-participation exam at the beginning of the season, right? If typically we know who our stars are, right? Like we know who the Michael Jordans, the LeBron James of the team is. And so if that person tells me that, yes, I get a really bad history of cramping, then I'm going to dive in right away to try and help them. So if that player does cramp during a game, hopefully I've done my homework before that point and I can say, okay, chances are it's maybe nutrient deficiency or maybe it's energy deficiency. And so we're going to stretch that muscle and try and break that cramp as quickly as we can. And then hopefully we know that person well enough to say, all right, for you, it's almost always nutrient deficiency. So maybe let's try a sports drink because there's a lot of sugar in sports drinks. And so we know sports drinks tend to retain water more. Like people always think like I'm anti-sports drink. I'm really not. I'm anti-bad science and I'm anti-bad marketing. We know you'll retain more water if your sports drink has electrolytes in it and sugar in it. That's just how our body works. And so if your cramp was due to the loss of fluid, and again, I'm not saying dehydration doesn't play a role in cramping, so please don't take away that from this conversation. Again, I think dehydration can cause premature fatigue, and there are other types of things that dehydration can influence. I just don't think it's the sole factor like everybody in the 1940s and 1990s thought it was. But if we give you like a sports drink, I think a lot of times it's the sugar in that sports drink that our body rapidly absorbs. And if we've been competing for a long period of time, we can get that boost in, carbohydrate and maybe alleviate some of the fatigue that will help get that person through the match. But oftentimes it's a losing battle, to be quite honest. Again, we've got lots of studies that have shown once you cramp, that system is now primed for future cramps. And so we'll, number one, get rid of that cramp as quickly as we can, usually with gentle static stretching. We might do some maybe massage just because massage feels good. So if pain was a contributing factor to the cramp, we're going to try and relieve some of the pain cycle. We might give some sports drink to try and get some sugar rapidly absorbed into the bloodstream and circulated to the cramping muscle. And then if we can, we'll do that for a period of time, try to be strategic for when we need that player the most. And so trying to allow the central nervous system to rest and recover oftentimes is equally important. So if we can hold that player out during a timeout or for a couple of minutes to help them catch their breath, help them reestablish as normal as they can before going back into the contest, these are all just strategies that you try to employ just to get your player through the game. And then once the game is over, now we can more fully attack the factors that might have contributed to them. Like maybe it was a meal, so we're going to focus on electrolyte replacement or nutrient replacement. We're going to work on pain reduction strategies, maybe with some like interferential current or modalities, maybe like some ice massage, something like that. But once that cramp occurs, oftentimes it's a very losing battle, and you're going to deal with recurrent cramping for the rest of the exercise session, unfortunately.
The popularity of things, and you mentioned it earlier, like pickle juice and things like that.
And quinine and other ones.
Yeah, these sort of factors that people try and use in the moment. Is there any data to support their use? And if so, what's the mechanism?
Yeah, let me talk about quinine first. So quinine sulfate or quinine or tonic water is quinine is the active ingredient in tonic water. In the United States, we banned the prescription of quinine because quinine sulfate and quinine prescription has some very serious side effects related to the heart. And so you don't want to cause heart conditions trying to fight something that oftentimes is an inconvenience, or it might cause a little bit of pain, loss of sleep if it happens at night, but we don't want to cause you any cardiac problems. So the USDA banned the use of quinine for prescriptions, and so you can't get that prescription from doctors in the United States anymore. You can buy tonic water still in the United States, however, but it's at a very much lower concentration. And so there was some Cochrane reviews that had been done a couple of years ago on quinine, and it is effective. Quinine is a muscle relaxant. And so when you take a muscle relaxer, you're, causing a much more difficult time for that muscle to contract. If the muscle can't contract, you don't get cramping. And so quinine is effective. But again, I would highly recommend to everybody, don't do quinine, don't do tonic water because of the side effects that occur with it. Now, some of the other things that are becoming more popular, the things like pickle juice or the cayenne pepper-based solutions, are gaining some more popularity. And the pickle juice phenomenon was really started from my lab. We did a study, again, where we dehydrated subjects, but we dehydrated them with one-legged biking. So they were in a heat chamber and they were doing one-legged cycling, so we could keep one leg completely rested and unexercised. And then we looked at the question, does mild dehydration cause cramping or change cramp susceptibility? And when you separate fatigue from the equation, that's why we did the one-legged biking, we induced the cramp in the rested, unexercised muscle, but we had people bike in a heat chamber until they lost a certain amount of their body weight. When you separate fatigue from dehydration, again, what we observed was there was no change in cramp susceptibility or cramp risk. And then we repeated that experiment with more severe levels of dehydration. So the first study I ever did was a 3% body mass loss, which people would say would be mild dehydration. And then we took people all the way up to 5% and even above 5%, which oftentimes is classified as more of a significant or severe body mass loss. And again, the results were the same. We found no significant differences in cramp risk, again, when you separate fatigue from dehydration. But the second part of that study was we induced the cramp, and then while people were cramping, we gave them either a double shot. So think about like 80 to 100 milliliters of pickle juice, or we gave them 80 to 100 milliliters of deionized water. And we gave them a volume that was consistent with their body weight. So the heavier people got a little bit more pickle juice or water. And then we compared how long the muscle cramps lasted following ingestion of the pickle juice and water. And what we observed was pickle juice actually shortened cramp duration by about 40% compared to drinking pure water or by nothing at all. And we also did blood samples at 1 minute and 5 minutes after they had finished drinking the pickle juice. And what we observed was there was no change in any of the major blood electrolytes or plasma volume or osmolality or any of those things. And the effect was so fast, usually in about 90 seconds, that we couldn't explain the absorption of the fluid through the stomach into the intestines, the effect was too fast. And so what we proposed was the pickle juice was probably causing some kind of oropharyngeal reflex in the mouth that was interrupting the excitatory stimuli from the brain to the cramping muscle. So I always purport it to people like this, like when you slam your hand in a car door, like that's very painful, right? And so to block that pain, what we do is we grab another portion of our body and squeeze, right? The brain can only handle so much stimuli before it kind of, gets, blurred. And so that's what I think pickle juice is doing. I think it's interrupting that pain cycle by providing kind of a noxious stimulus in the mouth that then causes that excitation to stop, and then the muscle cramp tends to shorten. Now, the thing I always remind people when I mention that study is pickle juice relieved the cramp in about 90 seconds on average, but stretching almost always relieves the cramp faster than that. And so when it comes to what am I going to do for an athlete that is cramping in front of me, it's not hand them pickle juice, it's stretch them. And then we'll try and figure out what was it that caused the cramp in the first place. But pickle juice does seem to have something special about it. Stretching with pickle juice?
Yeah.
Yeah, I think you could do that.
Effects?
I don't think that.
Like, have you noticed additive effects to doing like multiple, multifactorial? Obviously, you suggested it's multifactorial. So, is it worth adding these things together to try and get that, immediacy of a result?
Yeah, I think that's perfectly fine. And other people have asked me, well, what if we also, in addition to the gentle static stretching, had them contract their anterior tibialis, for example? If I'm, cramping my calf, the way the body works is if you activate a muscle on the opposite side of where the cramping muscle is, the body will inhibit that cramping muscle. So we call that, like reciprocal inhibition. And so that, again, perfectly makes sense. So if I have the patient bring their toes up toward their chest, in other words, dorsiflex their ankle while their calf is cramping, and I'm also helping them push their toes up, and so I'm gently stretching that calf while they're also trying to pull it up actively. If you give them pickle juice at the same time, I don't think you're going to cause any harm to the athlete to do that. I will say we did another study where we made people drink approximately 700 milliliters of pickle juice. And so we gave people almost a full
surely digestive problems.
Yeah, exactly. And so you laugh at that, but we published that data because nine out of the 10 people that we got to do this experiment got explosive diarrhea afterwards, like several hours after the study finished. And so I never advocate drinking that much pickle juice because it comes back to the why do you not drink ocean water if you're stuck on a desert island, right? The body tries to flush all that extra sodium out of your body, and so you dehydrate yourself even worse when you take in that very salty solution. And pickle juice has about the same amount of salt in it as the ocean does. And so whenever we do the experiments showing that pickle juice shortens cramp duration, it's always very small amounts. Like think a double shot, like 80 milliliters. It's a very small amount of fluid. So 80 milliliters, and we've done lots of studies to show this, does not change your blood sodium, potassium, calcium, magnesium, chloride, osmolality. It doesn't change any of the major blood variables when you take it in a small volume. But the reason why we gave that much pickle juice because we were using a technique to study how fast the pickle juice leaves the stomach. And one of the primary determinants of how fast something leaves the stomach is how much you ingest. And so we had to give that amount of volume to actually do the experiment. And what we found was after about the first 5 minutes, pickle juice tends to just sit in the stomach because all the secondary characteristics like its low pH, its acidity, its high sodium amount, all of those things tend to slow how fast the stomach pushes fluids down into the small intestines. And so when you drink a small volume like that, again, we take away the volume stimulus. The pickle juice tends to sit in the stomach for about 20 minutes. And so we had this, very interesting phenomenon where a very small amount of pickle juice tend to relieve a cramp faster than water or drinking nothing at all, but it didn't seem to influence any of the major blood chemistry indicators. And so that's why we said, well, it might be something happening in the mouth. And so people always ask me, well, could it have been a placebo effect? Possibly. But we tried to prevent the placebo effect as best we could. So we put nose plugs so they couldn't smell it. We didn't tell them what they were going to drink. I didn't know what they were drinking that day. They drank it out of an opaque bottle. We told all of our subjects, don't make any faces that might give away what you drank. So we tried to blind it as best we could. But as soon as that fluid hit the mouth, you knew you were drinking something. But we also never told our subjects what they could expect. So in theory, the pickle juice could have made their cramp worse. So it is a limitation of the study for sure. Again, I try to be fully transparent with people about that, but we have kind of this collective body of evidence. That's not just from my lab. We have some case studies showing that drinking pure vinegar, and I always advocate don't do pure white vinegar because it will kind of burn your esophagus. Ask me how I know that. Done that study too. Uh, Apple cider vinegar tends to be much more tolerable for people, or vinaigrettes or those types of things are easier on the gastrointestinal system. So if you're going to try something with vinegar, which is what I think is the active ingredient for why pickle juice works, I think you can do some other more tolerable fluids that contain vinegar than just pure pickle juice or pure vinegar by itself.
To finish off, Kevin, you talk about you having a very bad history of cramps. What have you found personally useful as a preventative measure?
Yeah, so again, people always shake their head at this. And again, I don't think that this works for everybody because, again, it might not target your individual cramp factors. But for me, pickle juice does work. And I've played around with this because if it is an oropharyngeal reflex, then in theory, you don't even have to swallow it, right? Just swishing it around your mouth and then just spitting it out might be enough to interrupt the cramp that's occurring and then stop the muscle cramp. Now, there was a study that was done, I think 2 or 3 years ago, where they tested that theory, where they just had people swish and then spit it out. But the thing that they didn't do is they didn't prime the system. So they had healthy, rested people, and then they induced the cramp with electrical stimulation, which again is what I typically do in my experiments. And then they gave people pickle juice and they swished it around their mouth and then they spit it out. And what they said was, oh, the pickle juice didn't work, it didn't relieve the cramp. But what you forget is you got to prime the system. If there's no factors that are contributing to the cramping other than you just shock people until the muscle cramped, then you might not be, setting the stage for pickle juice to actually work. And so that's where I think they need to do a follow-up study and just say, okay, we want to have people come in with some exercise, cause some fatigue to the muscle, and then see if, swishing pickle juice in the mouth relieves cramps or not. But for me, I've done, a lot of yard work, and at my last house when I lived in Michigan, I was spreading, multiple yards of dirt. And something that had rarely happened in my life, I got a cramp in my biceps because I was shoveling dirt and I was trying to, finish the job before it became nighttime. And I got a cramp in my bicep and I could not extend my elbow. And I told my friend who was helping me, I'm like, I'll be right back. And I'm not joking. I just went to my kitchen. I grabbed some Vlasic dill pickles and I just drank 2 or 3, 4 gulps of pickle juice. And within seconds, my cramp in my biceps went away. And again, I have no competing interest. I don't sell a pickle juice sports drink. I don't bottle this stuff myself. I'm not a proponent for all of these other companies on the internet where you buy pickle juice sport drinks. I don't do any of that stuff. But just for me, for some reason, pickle juice seems to help me with my muscle cramping. And again, also I'll stretch and do those types of things. But this was a situation where I was like, well, let's see if it works for me today. And sure enough, and then I was able to go out and finish the pile of dirt before nightfall without another cramp in my biceps. And again, doesn't work for everybody. And what I always tell people is, pickle juice is not a cure-all. Do not think that this is going to solve your problem, because one thing we have not studied is whether or not there's like a habituation effect. Like if it takes 80 milliliters for me to stop cramping today, will it take 90 milliliters next week, 100 milliliters the week after? That we don't know yet. And so again, if it's the vinegar, maybe if we just give a more concentrated dose of vinegar, maybe it helps better. And so again, there's a lot of questions that we still need to get answered regarding this interesting phenomenon. But for the people that might be listening that maybe have a history of high blood pressure, one thing I always tell people is, go talk to your physician first. You don't want to drink a small amount of pickle juice, because again, it's like drinking ocean water. So if you struggle with blood pressure or you have an allergy to foods, these are all part of the questions that we ask people to figure out what their recipe is. And so again, if you go back to that article, the first two questions in the table where we ask you the questions about figuring out your recipe, the first two are the first two on purpose. And those questions are, do you have any illnesses, allergies, or medical conditions? And have you noticed muscle cramps occur during exercise after a change in medication or drug use? And if the answer to those questions is yes, then we always tell people, go see a doctor before you decide to do anything.
Kevin, thank you very much for giving up some of your time today to talk to us about your research. We'll certainly put a link to that paper when we release the podcast as well. And I'm assuming you're on social media. People can find you on things like Twitter.
That would be a great assumption, but I've tried not to be. So
that's not a bad thing at all.
I'm one of those very old people that just has Facebook, so people back home can see pictures of my daughter and my family, and
Sure.
I try to keep up with people that way. But I'm one of those rare scientists that doesn't have Twitter, doesn't have Instagram, Snapchat, or anything like that. But I would say, if your listeners have any questions or anything, feel free to contact me. My email is kmiller, MILLER, at txstate.edu. I'm happy to answer questions via email, or if people want to give me a call on the phone, I'm happy to talk to people as well.
Great.
Thank you
very
so
much,
much.
Kevin.
Really appreciate it.
All right. Thanks, guys. Appreciate the opportunity. Have a good day.